you're walking outside the Atlantis, then you saw someone lying on the floor. So what you do first? Okay.
Check for the responses. Are you okay?
No response.
No response. Then you call 999 and get the AED. And check for pulse. No pulse, no breathing and stuff.
Later in the exam, I want to see you simulate the breath. Okay? I want to see you simulate the breath. You can come in taking with the AED. What you do first with the AED? Yes, very good. So once you open, you
Apply
on the
pads to
AED,
patients' bare chest.
so that there will be
Lighting
instructions
pad
telling you what
connector
to do.
next to flashing light.
So the first receiver keep pressing lah.
Yeah, the first I
Apply pad.
continue
Lighting
pressing while
connector.
yes, have to continue compression while she's attaching patch. Yes. Very good.
Analyzing heart rhythm.
So what you have to do?
Do
Analyzing
not
heart rhythm.
touch the patient.
Stay clear.
Shock applied.
Okay, shock advice.
Charging.
While charging, you can
Stay
continue
clear
to
of patient. Deliver shock now. Press the orange button now. Shock delivered. Pause.
Actually,
Start CPR.
after shock, you have to give CPR immediately. Okay, actually, should switch roles.
Our hand can stand by first, right?
Yeah, hover around that. But maybe after putting pads, analyzing heart rhythm, then when charging, right, you all can switch role. Okay? While charging, you can switch role. Or else the first rescuer will be very tired, right? Okay? So the second rescuer will do the compression. Okay? And she will maintain the hip chin dip. The first rescuer, after that, will maintain hip chin dip. Okay? Understand? We all practice. I'll see another group. But, yeah, you want to join them? Rotate lah.
Yeah, yeah, yeah.
Who want to be the first rescuer? Start. You go help and get an AED.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector. Apply pads. Plug in connector. Analyzing heart rhythm. Do not touch the patient. Press pads firmly to patient's bare chest.
Press pad firmly. So you
Analyzing heart rhythm.
then she will come go there.
Do not touch the patient. Shock applied. Charging. Stay clear of patient.
Charging can press. Charging can hold press.
Deliver shock now. Press the
Now,
orange
before that,
button
you have
now.
to tell everyone, stay clear,
Stay clear.
loud and clear. Or else the children
Deliver shock now. Press the orange button now. Shock delivered.
So after shock, immediately CPR.
Start CPR.
So you, as a second responder, you encourage the first responder. So you hover around the chest. You, yeah,
Just
yeah. So
stand by the chest.
ready to start lah. Can you switch roles and practice? I want to watch them.
Okay.
You see the first responder.
Yeah.
Okay, thanks.
So I approach and check the safe seat. Okay, so safe, I go. Hello, sir, are you okay? Hello, sir, are you okay? Hey, you, go and take AD and call 999 and come back to me. Okay, so, check. No breathing, no pulse, no something, no CPR.
Too fast, too fast, too fast. Too fast, too fast. Slow down, slow down. Slow down, slow down.
30. Okay.
So I think the six months it's not
Apply pads to patient's bare chest.
30. One, two, 5, 7, 10,
Apply pads to patient's bare chest. Plug in pads connector next analyzing heart rhythm. Do not touch the patient.
30.
Apply pads to patient's bare chest. Plug in pads connector next stage clear of patient.
Stay clear.
change the breath.
Deliver shock now. Press the orange button analyzing heart rhythm.
Okay.
Do not touch off the
Deliver
patient.
shock.
Press hands firmly on patient's bare
So
chest.
you have to tell her shock deliver,
Shock deliver.
continue CPR.
Continue CPR.
This is a team dynamic.
Okay.
Analyzing heart rhythm. Do not touch the patient. Shock
Then
applied.
you should be here
Charging.
with the
Stay clear of
and
patient.
hip.
Deliver shock now. Shock delivered. Pause.
So he maintain the patient
Start CPR.
Fast.
The question, AD said, is it something at the side or on top of it?
At the side here.
Okay.
Yeah, not on top of the head. Yeah.
Okay.
Thanks for the question.
Right.
You get the EAD and check for us. They check for us. No pass.
Okay, AD starting.
Low battery. Analyzing heart rhythm. Do not. Low battery. Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Analyzing heart rhythm. Do not touch the patient.
Have to continue CPR.
Shock advised. Charging. Stay clear of patient.
Stay clear.
Deliver shock now. Press the orange button now. Shock delivered.
So deliver.
Pause.
Switch roles.
Start CPR.
So we will maintain the and then coverage. Maintain the diffusion.
Thirty. This one not sticky enough.
So when analyzing heart rhythm or when charging or your can still do
Stretching. Okay.
Okay.
Apply pads to patient's bare chest.
Compressing.
Plug in pads connector next to flashing light.
You have to practice on your speed. The speed are too fast, too slow.
Okay.
Yeah, remember the beat lah.
Apply pads.
Measure the.
Plug in connector.
Okay.
Okay. Okay, you all practice and can start the assessment already. You all practice among yourself. Okay.
Analyzing heart rhythm.
While compressing the
Do not
another
touch
person is
the
like
patient. Press pads firmly to patient's bare chest.
I am waiting for assessment.
But don't put it on here.
You ready?
Analyzing heart rhythm. Do not touch the patient.
Tak dalam sana. Dia masak saya tak.
Analyzing cannot.
Shock advised.
Cannot.
Charging.
Charging.
Ke bawah sekali.
Stay clear of
Yes.
patient.
Tak sama advantage.
Deliver shock now. Press the orange button. Shock delivered. Pause. Start CPR. Stop CPR. Analyzing heart rhythm. Stay clear of patient.
Yeah.
Start. Start.
Tangan.
Analyzing heart rhythm. No shock advised. Pause.
No shot advice.
If needed, start CPR.
1, 2, 3, 4, 5, 6, 7, 9, 10.
Yeah, your paper. So I will do your AD and I will do her AD and I'll do her CPR. So I think your name, write your name and date. You're not ready.
Replace pads.
Now again. Just now you're alright, eh? Now exam assessment different, huh? Off already, ah.
Stop CPR.
Okay, again.
Apply pads to patient's bare chest. Plug in pad connector next to flashing light. Analyzing heart rhythm. Do not touch the patient. Press pads firmly to patient's bare chest. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient.
Stay clear for patient. Everybody clear?
Deliver shock now. Press shock delivered. Pause. Start CPR.
Just now you should switch already, yeah. Yeah. And then the pads, you see correct or not? Here. Here. Not the collarbone there. Below the collarbone. Okay. So, want to do again? So, you want to be the first, this one. This is okay, alright lah. You're alright. It's just that you all should switch those and then encourage the CPR coach also. Okay? So I think switch roles now. Switch roles first. Switch roles when charging. Switch roles when analyzing heart rhythm. Also can. Okay? Okay, you all fill up your names lah. Okay. So you become the second responder, then you become the first responder. This one assessment is okay. Just take it as like just now what your practice.
Kacau lah, kacau memang.
Yeah, see, you like have to follow the picture of the cat. Okay, so you have a very good question. So last time I don't know what they teach you lah. So I mean, okay. So actually by right you have to follow the picture because this is sometimes on the machine right AED there's a one way shot. Sometimes the two-way shot. Two-way shot is fine. If it's the AED, yeah, in either one you can put up. If it's a one-way shot, then the shot will be the position will be different. Yeah, so I mean for safety reasons we put follow the cat. Okay.
Apply pads to patient's bare chest. Plug in pad connector next to flashing light. Apply pad. Plug in connector. Analyzing heart rhythm. Do not touch the patient. Press pads firmly to patient's bare chest. Analyzing heart rhythm. Do not touch the patient. Shock applied. Charging. Stay clear of patient. Deliver shock now. Red shock delivered. Pause. Start CPR.
The confession. Okay. Tất cả xem một lại thành trụ qua rồi. Này. One second. One. Yeah. Mọi người sẽ sổ mà. So this can hear that. You didn't hear the spring sound. You answer first.
Can we take out the mask of this one?
Not the mask.
No,
As long as
we
your
comfortable because we just
social distancing.
sitting because the mask.
When compressing, I mean.
The saliva over there. Never mind.
Who wants to be the first responder? Who wants to be the second responder? Okay, you're walking outside lah. So, you saw someone lying on the floor.
Okay, check. Check the seat is safe.
Okay.
So I push. I tap. Hello, sir, are you okay? You go call 999 and take the AD. No problem, from beginning, so I will start my CPR. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Apply pads to patients' bare chest. Plug in pads connector next to flashing pump. Apply pad. Plug in connector.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28.
Apply pad. Plug in connector. Analyzing heart rhythm. Do not touch the patient.
You clear? Clear? Everybody clear?
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Pause. Start CPR.
So you all realize that you all didn't switch roles, ah?
Yes, yes, yes.
Yeah, and also we didn't communicate. I also didn't hear you like encouraging her or telling her that she's too fast or you're doing good. Okay?
Communication.
Yeah, this is a new thing in BLS.
Yes.
Sometimes
Yes. Okay.
okay, but you all have passed the AD and you have passed the acute infection. Now switch roles lah. Rest first. Okay.
Sorry, for rescue one, you can give encouraging also, right?
Um,
You try already tired.
No, I mean when the the logic is when the one who's at the head, right, doing the
airbag mask.
the back mask, right, can encourage the compressor.
Okay.
The logic is that.
Yeah lah, because we already hired already for the compression.
It's not the compressor encourage, it's the back mask ventilation encourage the rescuer, the compressor.
Okay.
Okay? Who wants to be? Have it. Best first lah.
Stop
I
CPR.
can take AED lah.
You take the lead.
Analyzing heart rhythm.
The paper.
Wait ah.
Just please standing up.
You call 999 with AED. And if you don't know how we do CPR.
Apply pads to patient's bare chest. Plug in pad connector next, analyzing heart rhythm. Do not touch the patient. Shock applied. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
Yes, now.
Shock delivered.
So deliver.
Pause. Start CPR.
Ni harga start CPR lah. Infant. Infant. Adika give me colourful.
Never mind, I use the colourful one. That's one. Let it stand. Just let it stand. Let it dry. The back mask you. Let's start the compression. Okay, now is you have improved. I can hear the, you have got a good depth, at least 5 cm. Really, but speed, adjust speed, too fast. Okay? Ready? Thank you. If you want to go for toilet or something, you can go.
The only one. Dari mana?
Applied pads displaying their check.
Tak dapat.
Plug in the pads connector, next analyzing
Sudah tak kasi
particles.
fokus.
Do not touch the patient.
Ini habis kita. Tenang.
Shock applied. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Hold. Start CPR.
Now that we've covered adult BLS, let's discuss BLS for children. It may be difficult to imagine a child being a victim of cardiac arrest, but it certainly happens. Pediatric cardiac arrest isn't as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related, but in children and infants, cardiac arrest is often due to respiratory problems, such as airway obstruction, drowning, opioid overdose, or seizures.
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters. And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.
Before I go to let y'all practice, so what's the difference between the adults and the child? The child, the depth, how much? At least 1/3. 1/3 of the depth. And then approximately 5 cm. But adult is at least 5 cm. Okay? The rate is the same, 100 to 120. Okay, and allow full chest recoil, minimize interruption for less than 10 seconds is the same. So how about the compression is to ventilation ratio? If it's for 1 rescuer, 30 is to 2. What if it's 2 rescuer? 15 is to 2. Very good. So if it's unwitnessed collapse, so what do you do first? 5 cycles. 5 cycles first. Then if it's a witness, yeah. For nowadays we got a lot. I mean we have handphones, but child. Your share lah. Now come to your place. Share. Okay, that's that.
Now that we've covered adult
So 2 men. Maybe you share with them. 2 men.
So let's count down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen. Let's go in 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED.
And compound and breathing.
There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Now switch lah, switch.
So 2 rescuer is 15 to 2 ah.
Yes, 2 rescuer is 15 is to 2.
So let's count down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen. Let's go in 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Want to switch again?
Back mask? Clean already.
I mean, this won't be in the skill test. So, just a practice lah.
So let's count down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen. Let's go in 3, 2, 1.
Check the seats is safe.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
So giving the breath, if you have a back mask, right, it's the same thing. In until there's a chest rise.
So let's count.
So now, depends on you. You want to sit down or sit on the chair. Now we are watching a video.
Chair.
Depends on you.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can feel completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we use for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device. Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and isn't breathing or is only gasping, send someone to activate the emergency response system and get an AED. If you're alone and don't have a mobile phone, take the infant with you to phone emergency services. Or, if necessary, leave the infant and find a phone. But if no one witnessed the infant's collapse and there's no response or breathing, check for a brachial pulse immediately. If you do not detect a pulse, perform 2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
If an infant has an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds, which is about 20 to 30 breaths per minute. To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, press your index and middle fingers gently against the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, there are 2 options for hand and finger placement when performing compressions on an infant. The first technique is to place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest, just below the nipple line, but be careful not to press on the bottom of the breastbone.
The other is the 2-thumb encircling hands technique. Place both thumbs side by side in the center of the infant's chest, on the lower half of the breastbone. In very small infants, your thumbs may overlap. Don't apply any pressure on the tip of the breastbone. Now, encircle the infant's chest and support the back with the fingers of both of your hands. In this position, both thumbs will be used to depress the breastbone.
Whether using the 2-finger or 2-thumb encircling hands technique, once in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be at least 100 to 120 compressions per minute. After each compression, allow the chest to recoil completely.
As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. Allow the chest to completely recoil after each compression, and count out loud as you deliver 30 compressions. So, let's get into position to practice compressions.
So, for child and infant, the weakness and unweakness is the same. So if it's a witness one, then what you do? Witness one.
If witness.
Yeah. Then if it's a witness, then you call unwitness. Suck. Okay. So for infant and child, the difference is the debt. It's also the same. At least 1/3. I mean for adult, it's also the same. It's 1/3 lah. Okay. At least 1/3. Then how about approximately
4
cm? Okay. Then the hand technique. Yeah. 2 finger technique or the thumb and circling technique. Okay. Now you can come down here already. Shell. Infant is also the same. You can on this, then you will see the light. You are compressing the right. So the technique is where's the position of the 2 finger? You see below the nipple line. Okay? You can do this or you can do this, whichever is comfortable. Okay? I prefer like that. Can measure. Okay.
Here. Let's go in 3, 2, 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, this is for one man, right? Just now they say that one man you can use the thumb and circling and the finger technique for one man. If it's 2 men, it's a thumb and circling technique. 2 men is a thumb and circling technique. 15 is to 2. Okay, 1 man is 30 is to 2. Okay, then how do you all check the pulse? How? Let me see. Yeah, very good. Yeah, very good. How do you all check for the responsiveness? Very good. Switch roles.
Why cannot take shoulder with me?
No.
Okay, sensitive.
Let's go in 3, 2, 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
So use the palm of your finger, not the fingernails.
Let's go in 3, 2, 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
'Left.
Now, let's look at the technique for delivering infant breaths with a bag mask device. This is similar to the adult bag mask technique we practiced earlier. 2 things to note before you start. 1, make sure you have the right size mask so that it isn't too big or too small. And 2, remember that chest rise is the most observable sign to determine the effectiveness of your rescue breaths.
First, position yourself directly above the infant's head. You'll use the EC clamp technique that you learned earlier. But be aware that if you tilt or extend an infant's head beyond the neutral position, the infant's airway may become blocked.
Ensure a tight seal between the mask and the infant's face, and squeeze the bag with your other hand to deliver just enough breath over 1 second to make the chest rise. If the chest does not rise, then you're not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air.
Now, let's practice 5 sets of 2 breaths. Deliver each breath over 1 second, deliver just enough breath to make the chest rise, and make sure you have a tight enough seal with the mask on the infant's face. We'll pause here while everyone gets into position.
Okay, so child and infant, how many breaths?
2,
2 to 3. 20 to 30 per minute.
Now, let's
Follow along with the video. Here we go in 3, 2, 1.
The breath first, the breath.
give 2 breaths.
Ensure there's a chest rise.
Give 2 breaths. Give 2 breaths. Give 2 breaths.
Chest rise. Ensure there's chest rise.
And give 2 breaths.
Okay, switch rows.
follow along with the video. Here we go in 3, 2, 1.
Give 2 breaths.
Chest rise, right? Chest rise.
Give 2 breaths. Give 2 breaths. Give 2 breaths. And give 2 breaths.
Okay, switch roles now.
Follow along with the video. Here we go in 3, 2, 1.
Give 2 breaths. Give 2 breaths. Give 2 breaths.
Chest rise.
Give 2 breaths. And give 2 breaths.
Follow.
This is a 2 rescuer infant CPR.
Now it's time to practice 2 rescuer infant CPR. But before we begin, let's note a couple of differences between 1 rescuer and 2 rescuer infant CPR. One difference is the hand and finger placement for giving compressions. In 2 rescuer CPR, the person doing compressions should always use the 2-thumb encircling hands technique.
The other key difference between 1 rescuer and 2 rescuer infant CPR is the compression to ventilation ratio. As mentioned before, instead of a 30-to-2 ratio in a 1 rescuer situation, 2 rescuers should use the ratio of 15 compressions to 2 breaths. So let's practice compressions for 2 rescuer CPR. As a reminder, make sure your rate is between 100 to 120 compressions per minute. Use the 15-to-2 compression to ventilation ratio because you have 2 rescuers. Make the compressions approximately 1.5 inches or 4 centimeters deep. Allow the chest to fully recoil after each compression and count out loud for your partner.
Time to practice 2 rescuer infant CPR, starting with scene assessment. We will pause here while you get into position with the mannequins.
So the steps are the same as the adult.
Now,
Scene safety,
Same.
check for responsiveness, to respond. Okay.
here we go in 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing and no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
15:2, and it's a hand encircling technique. It's thumb encircling same technique.
Here we go in 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There is no breathing and no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
'Here we go in 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There is no breathing and no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
'Here we go in
There are some differences when you're using an AED for infants and children younger than 8 years old. Some AEDs can deliver either an adult shock dose or a child dose for children younger than 8 years old. A pediatric capable AED will have features that allow a child appropriate shock, but the available features depend on the type of AED you're using.
Your AED may also include smaller sized pads that are designed for children younger than 8 years of age. If it does, use them. If not, use the adult pads, but make sure that they do not touch or overlap. But never use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and likely won't be successful. It's better to provide high quality CPR than attempt to shock an adult with child pads. Some AED pads recommend placing one pad on the chest and one pad on the back for infants and children. Follow the pictures on the pad packages for proper placement.
If an infant needs defibrillation, a manual defibrillator is preferred. But as we mentioned before, this device is quite different from an AED and it requires special training that is not included in this course. If a manual defibrillator is not available, an AED with a pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
For the back, right? I say want to put at the back. So need to remove this.
Yeah, correct, at the back.
What are the method to remove?
If the, okay. Baby, you all see? Okay, the baby hand like that. Then put the pads like that. Okay, then put back.
Children also? Children?
Children, children you have to,
Two person?
yeah, 2 person, no? 1 person cannot. Yeah, if it's a trauma, I mean, if it's a accident or something, try not to move the body lah. Try to move, how to say, try to move a log roll. Try to move the body in a straight line, huh? That means turn with someone else. then paste the text, then put back with a command 1, 2, 3. Okay? So now practice.
There are some.
Okay, so after the, so I'm going to show you the choking. After choking, then we will do a assessment for 2-man CPR, infant CPR.
When food or other items block a person's airway, choking occurs.
You can take
In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak or breathe, or cyanosis, that is, turning blue. Adults or older children who are choking may clutch their neck with both hands, making the universal choking sign. If someone indicates that they are choking and cannot talk, you must act. For someone who is standing, you'll perform an abdominal thrust.
To perform an abdominal thrust, stand or kneel behind the person and place your arms around the waist. With one hand, locate the navel. Then make a fist with your other hand and place the thumb side of your fist against the person's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the abdomen with a quick, forceful upward thrust. Repeat thrust until the object is expelled from the airway or the person becomes unresponsive.
If you can't wrap your arms around the waist because the person is pregnant or overweight, or simply can't stand, wrap your arms around their chest and give chest thrusts instead of abdominal thrusts.
If you're not able to relieve choking in an adult or child, or if the person becomes unresponsive, have someone activate the emergency response system. Then lower the person to the ground and begin CPR.
Perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep because this may cause the object to become lodged farther back in the airway.
Okay, so it is this one might come out in the theory also. So it is a conscious person choking. So adult, what do you all do? Abdominal thrust. Pregnant? Chest thrust. If unconscious, lying down on the, unconscious? Yes. So you lie down, let the person lie down on a firm flat surface, then do CPR. Okay?
When food or
Choking is also a fairly common emergency in infants. The steps to relieve choking in an infant are quite different from those for older children and adults. If you find an infant who is choking but is still responsive, first sit or kneel with the infant in your lap. Hold the infant face down and resting on your forearm with the head slightly lower than the chest. Support the head and jaw with your hand. Avoid compressing the soft tissue of the infant's throat.
Then rest your forearm on your thigh to provide support. With the heel of your other hand, deliver up to 5 forceful back slaps between the infant's shoulder blades. Deliver each slap with sufficient force to attempt to dislodge the foreign body. Then place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your 2 forearms as you turn the infant over while carefully supporting the head and neck.
Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts in the same location where you would perform compressions, just below the nipple line, over the lower half of the breastbone. Do this at the rate of about 1 per second. Repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed or until the infant becomes unresponsive.
Okay, so how you hold the baby? So the palm and the index finger at the jaw there. Okay, then turn the baby, cradle the baby. Okay, later you will see lah how they, and then give a 5 back slap in between the So we do not perform blind sweep. I mean, if you did not see anything inside the mouth, right, don't anyhow like, go away. Yeah. So because they will push the foot inside.
Choking is also a fair.
Now that you're in position, let's begin. Follow along with the video as you practice. Here we go in 3, 2, 1.
1, 2, 3, 4, 5.
The hip should be lower
1,
than the chest.
2, 3, 4, 5. 1, 2, 3, 4, 5.
Use your
1,
knee.
2, 3, 4, 5. 1, 2, 3, 4, 5.
Harder.
1, 2, 3, 4, 5.
Switch. So it's the same thing as infant. I mean, same thing as for infant, same thing as the adult lah. If the baby suddenly turn unconscious, put on the firm flat surface and start CPR.
Now that you're in position, let's begin. Follow along with the video as you practice. Here we go in 3, 2, 1.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Baby, when you turn over.
1, 2, 3, 4, 5.
Because the baby will be struggling. Then you will be, it's like very hard to catch the baby also. Okay?
Means when we move, if like this, I hold it.
Yeah.
So when you want to switch,
Yeah.
like this
Make sure that it's like you really sandwich the baby lah. Okay? The head should be lower than the chest.
Now that you're in position, let's begin. Follow along with the video as you practice. Here we go in 3, 2, 1.
1, 2, 3, 4, 5.
Harder.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Now, as with an adult, if a choking infant becomes unresponsive, shout for help and have someone activate the emergency response system. Then, lay the infant face up on a hard, flat surface. You'll perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the object.
To give breaths for an infant, the mouth-to-mouth and nose technique is preferred. For this technique, you will first open the infant's airway with a head tilt chin lift. Then, place your mouth over the infant's mouth and nose to create an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift to reopen the airway and try to give a breath that makes the chest rise. If you cannot cover the infant's mouth and nose with your mouth, use the mouth-to-mouth technique instead. The mouth-to-mouth technique for an infant is the same as for an adult.
If you can see the object, carefully try to remove it. Never perform a blind finger sweep. You should only try to remove an object if you can see it. If you're alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system. We'll We'll pause here while you get into position to practice with the infant mannequins.
Don't want to go toilet? If not, I can test for the 2-man infant CPR. Okay? Want to start?
I go to the
Yeah, I go toilet. Okay, start. So it's almost the steps are same as the adult. Check for safety, hello, are you okay? No response. Then, how? Just now I saw it's check for pulse, right? But actually it's activate the emergency response. Then check for pulse. Okay. Then I want to see 2 techniques lah. So that when there's one rescuer, then you use the finger. If there's 2 rescuer, you use the thumb. 1 rescuer, how many? Is it 2? 1 rescuer is 30:2. 2 rescuer? 15:2. Yeah, so mix up. Okay, who wants to start first? Your paper. It will be the how do I address you? Yeah. So you are in a party. Nani, tap 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 tap. Nani, no response. Amen. How is you? What you do? No. Encourage her. fast with the baby. Help.
Call for emergency.
You know that?
Check the seats. Safe.
Okay.
Put the baby first. Baby, are you okay? Baby, okay? No response. Hi, Frank. Can you go and get AED and call 999? Okay, go ahead. Check. No response.
theory test.
No, I think you can open your book, but cannot go to Google. Make easy lah. The multiple choice, right?
Yeah. So you shade lah, like that. So after the exam, after the theory, please help me to do a feedback. The QR code is there. So you write a version A or B.